Together we achieve victory over heart failure.
Hi everyone, I am Dr. Harsha Reddy. I am a cardiologist at Jabalpur, Eknayak Multi-Speciality Hospital, Madhya Pradesh. So today we want to speak about monitoring your heart failure conditions and how you know your numbers and vital signs. So heart failure is a very important issue and a very common problem which occurs in many individuals. It is very common in our subcontinent, in the Indian subcontinent, and at the same time the Asian and also the Western population. Because of more educative measures, as in we're doing right now, and more of public awareness, now people have come to know more about heart failure. But then it's only the tip of the iceberg, which actually people know about it. So the main problems which you face, as in case of symptoms, when you have heart failure, which have not been diagnosed, there are actually two aspects of the issue. One, you have not the patient has never been diagnosed with heart issue, or they have been already diagnosed and then they've been on medications and continuous monitoring. So coming to the first case scenario, wherein patient or you yourself doesn't know how your heart is, or do you have heart failure or not. So when you go clinically, the first important symptom is having breathlessness, having swelling in both the limbs, both extremities, lower limbs or lower legs. Then sometimes having facial puffiness, feeling breathless on walking or doing any activity. At the same time, having breathlessness on lying down. And some people can have chest pain when they have associated coronary artery disease. And when you go to the doctor as a cardiologist and then you get yourself checked, the first thing is your BP might be high, which may be the first cause of heart failure, that is hypertensive heart disease, because of increased blood pressure causing increased pressure on the heart and then leading to the symptoms. It is basically increased filling pressures in the heart, which is actually a heart failure, which is actually the actual definition. So there can be many causes. And then on examination, patient can have low BP or even high BP, and then you get an echocardiography done, which will actually show how the pumping capacity of the heart is. So there are three types, wherein the heart ejection fraction or pumping capacity is normal. It can be in the mid-range or it can be low. So the most of the patients or the maximum population is under the category wherein the heart pumping capacity is low. That comprises the major part of it. And then coming to the other scenario wherein patients or you yourself know that you have a heart condition, as in your heart pumping capacity is weak, or you have increased pressure in the heart, which is causing your symptoms, and then you've already consulted a cardiologist or a doctor, and then you've been being monitored, wherein you should be looking for increase in symptoms or aggravation of symptoms, as in breathlessness or palpitations or swelling of the feet or having breathlessness on lying down. So this is very important, and timely checkups and timely interventions are very important to avoid hospitalizations and give a good quality of life, and also in order to improve the heart status. So what you have to do is, get your BP, blood pressures and heart rates and cardiac evaluation regularly checked, probably every monthly or every 3 monthly or every 6 monthly, depending on the scenario or depending on the position or the clinical condition of a person or a patient. And you also have some monitors which can be kept at home. As of now, things have gone very advanced, and then there are some monitors which can be some mobile-like monitors which can also monitor your pressures and blood pressures and heart pressures at your home. That will mean that you can be consulted with the concerned cardiologist or your concerned doctor, your primary physician, where he can advise you and suggest you accordingly. According to there are three aspects. One is diet, one is medication, and the other is regular checkups. Diet, low salt intake. If you talk in lame terms, probably your whole salt intake should not be more than one or two teaspoon in a whole day. Consuming it may be in your food or your drink or whatever it is, whatever you consume, and at the same time taking your medications regularly and then having a healthy lifestyle. Thank you.